President Trump taking aim at the opioid crisis in the country. Here now is Republican Congressman Andy Barr from Kentucky, who was at the president's event earlier today. Congressman, who or what do you blame most for this crisis?
Well, of course, it's a terrible epidemic that's affected the entire country. But in Kentucky, my home state, we suffer from the third highest drug overdose mortality rate in the country. Frankly,
let me just stop you there. Why is that, Congressman? You have such a small state. Why would you have so many opioid deaths?
Well, there's hopelessness and economic distress in certain parts of our communities. We've had a severe downturn in our coal economy in the mountain communities of eastern Kentucky. But down economy and hopelessness is not the only reason. We have a public policy response that has been deficient. We have overprescribing. We have physicians that aren't adequately trained. We are overprescribing narcotics. We have an unsecure southern border. We are faced with Chinese fentanyl manufacturers that are pumping fentanyl into our country. So,
by the way, the president called that drug evil today. Do you agree?
I totally agree. Totally agree. And I applaud the administration. I applaud the president for this bold response to this epidemic. We are losing 175 Americans a day in terms of drug overdose deaths.
To another one of your points, though, about the prescription, the overprescription, there are 214 million opioid prescriptions that were written in 2016. That's actually down a little. A couple of years earlier, it was 255 million. But our own Dr. Siegel says that's way too many. Doctors are just prescribing these things like they were candy. How do you stop that?
Well, I think we have to have a prescription monitoring program, a more robust prescription monitoring program. One of the initiatives that the president announced also was working with the National Institutes of Health and the Department of Health and Human Services to more robustly educate and train physicians and prescribers about the dangers of opioid addiction. But hold on. Why
would you have to educate doctors about the dangers of too much opiates? I mean, that's common sense, is it not? Particularly for a doctor.
It is, but, you know, bad public policy, HHS policy regulations coming out of CMS actually reward hospitals and physicians and healthcare providers for managing pain. And so when you get reimbursed at a higher rate because you're getting higher scores for just prescribing pain medication and medicating people, that's the wrong public policy.
Congressman, I think it's a little simpler than that, and perhaps a little worse than what you're describing. I think it's that doctors realize that if you want to shut up a patient, if a patient is complaining, you just write the prescription. That shuts them up. Literally, sometimes if somebody comes in screaming, it's easier than actually getting to the cause of the problem rather than just treating the symptom.
But we also need to promote programs like enhanced recovery after surgery, non-drug pain management techniques that are frankly coming on quite strong. And there's a lot of research to support anesthesiologists and pain management moving away from narcotics and other kinds of pain management. So this is what the announcement at the White House was about. It was a comprehensive strategy. It's not just law enforcement, although there's certainly a role for the Department of Justice here. It's also about education and training of physicians and a national prescription monitoring program. But it's also about the FDA and making sure that prescription pill manufacturers are not doing the wrong thing and doing the ethical thing in terms of the type of drugs and how they're marketing them. And also partial fills. You know, when you recover from a surgery, you don't need 30 or 60 days worth of pills. If you need opioids or narcotics, maybe 7 days is enough.
Okay, Congressman Andy Barr, some good suggestions. Thank you very much. Best of luck to you. It's killing 33,000 Americans a year. This has to be stopped. I appreciate it.